Can you tell us a little bit about, before InFoods and some of the newer things that are out there, how did you manage these patients? What did you use to treat them? I think there's drugs out there. Can you tell us a little bit about the effectiveness of the drugs and some of the things that you've used to treat IBS patients and historically?
Yeah, absolutely. So these patients, as I said earlier, come with abdominal pain. To have a diagnosis of IBS, you must have that pain component. But they can have constipation, they can have diarrhea, they can have both constipation and diarrhea. That's the mixed type, right? But a lot of these patients also have bloating. And the other big issue with these patients is how unpredictable these symptoms are, right? So they're, having to leave social gatherings earlier. They're, work productivity is being affected. It really, their world becomes smaller and smaller because of these symptoms, right? So when we tackle them, to answer your question, the first step is lifestyle modifications, right? So we do the best we can to advise them on some dietary modifications, but it involves also fiber intake and a lot of over-the-counter medications, and that would include things like Imodium, or fiber supplements, fiber laxatives. So that's kind of the initial step, right? And then after that, majority of physicians are using prescription drugs. Whether those are drugs to help with the diarrhea component, or the constipation component. And a lot of these drugs, have a cost to them. And a lot of times the cure ends up being worse than the disease itself. Because, for instance, somebody that has constipation now is given a drug to help with the constipation, but now they have diarrhea, right? And so these patients end up on just like this drug carousel where they're just moving from one drug to the next. They have to dose escalate the drug, and it's just then they have side effects or it's not working, and so now we try a different drug. And so this is kind of how it's been traditionally managed.